Hello, this is Amaresh Tripathy. I run the analytics business at Genpact, and today I have a very high-powered panel with me to talk about uh, COVID-19 and population health and the role of data and analytics that it plays in that context. So with me today, I have Himanshu Arora, who is the Chief Data and Analytics Officer at Blue Cross Blue Shield of Massachusetts. Himanshu, welcome.
Thank you.
Uh, I have Mike Magnini, who is the Director of Enterprise Analytics Delivery at BCBS Massachusetts. Mike, welcome.
Hi, everyone.
And Esteban Lopez, who is the market lead for healthcare and life sciences at Google. He's also been the founder of a healthcare data company called Hopscotch Health and a previous chief medical officer at one of the Blues. So Esteban, great to have you.
Hey, everyone.
Perfect. So what we thought about is in this kind of a keynote to kind of switch it up a little bit and take a telescopic view of we are a year into the pandemic. Population health was a very hot topic even before the pandemic. And during pandemic, it obviously kind of became here and now, and the role data analytics kind of played. And what we really wanted to do is kind of go back a year, look at where we are today, and also think a little bit about where we are going in the future. So that's kind of the context we'll kind of set up. So let me start with you, Himanshu. When pandemic hit, right? I mean, March. We were chatting a little bit at that time, March of 2020. How did you react? Like, what were the priorities that we were working on? What did you deprioritize? What did you pivot to? Problems and solutions that we are now dealing with. Help us understand. Take us there a year ago, almost a little bit more than a year ago, and then kind of recreate it for us at what you were going through.
Yeah, no, happy to, Amrish. A great question. And, looking back at 14, 15 months ago, it seems both shorter and longer than time frame. It's a weird time space that we find ourselves in. And I think transporting ourselves back to that time, a few things, and I'll first talk more at the enterprise business level, right? So to set the context of where we applied then enterprise data and analytics, is that as the broader economy sort of started to grind to a halt, right? We started seeing economic pressures emerge for our customers, for our members, and for our providers. So on one hand, when you look at it from a customer's perspective, there's a lot of uncertainty around what the immediate future would look like, what the rest of the business year 2020, calendar year 2020 would look like, creating revenue pressures on that side, therefore creating a ask, almost an expectation to say, hey, what can be done on the healthcare cost side? Then on the provider front, right, as they've been our heroes all through this, and the depth and the breadth of the work that the healthcare systems have handled through the course of this pandemic is unimaginable, and no amount of gratitude will cover it. But from their perspective, they were also looking at, hey, while we are fighting at these front lines, what can we as a health plan do to help them make sure that they are able to do what they most need to focus on? And of course, in the middle of this is the most critical, important entity, which is our members, right? So if you sort of put the health plan and then these three entities around it, those were the immediate pressures going back to March last year that we started to experience and then respond to. One of the things we very quickly recognized was that from an enterprise data analytics perspective, we actually had the different layers of data that we needed to perform the analysis, applying advanced analytics and machine learning, to on the other side come out with a clear view of who are our members, who are most at risk, where do they reside in terms of general geographies, what is their proximity to get at the time testing them, and later on in the year, access to vaccinations, etc., and all through today. And where were the hotspots emerging as we were seeing national data, state level data, Massachusetts level data emerge, right? So, and Mike and team have done a fantastic job bringing all of those different data sets together and creating insights off of which we then took and turned into prescriptive actions for all of the ways in which we engage with our members. So, Mike, I'd love for you to talk about the work that we did there and demonstrated the real depth that we were able to get to and the speed at which we were able to respond with. So, Mike, go ahead.
Yeah, absolutely. Thanks, Himanshu. And as Himanshu mentioned, when we talked with our leadership about what analytics could do to support during this time, the top two initiatives were really what can we do to support our members and what can we do to support operational stability. And with the supporting our members, we quickly acted to pull whatever data we had to available about our members. And we know quite a bit about our members' demographics and healthcare experience, geography, access to providers, as Himanshu mentioned, access to, at the time, testing centers. It's hard to think back, this is before vaccines. Now all on our minds are just, well, where are the vaccines? But at this time, it was really just who is at risk? Where are these hotspots emerging? And where can members go to get resources? And really what Blue Cross emerged as during this time was really a trusted advisor for our members. We learned that members were looking for guidance. They were looking for information from a trusted resource. And through analytics, we were able to identify those members who really needed help and who valued that outreach call from Blue Cross, telling them, we're thinking about you. We see you as a high-risk member potentially. Here's what you can do. Are you supported? Do you need help getting food? Things like that. And this took an organizational effort with analytics at the center. We aligned immediately with our clinical teams, with our sales and accounts teams, with our member services teams. We even engaged with some external resources on studying epidemiology in the area, and really used that knowledge with our data to stratify those members. Who's the most vulnerable? What are their clinical risks? What are their socioeconomic risks? And then how can we quickly engage those members with the support that they need? And I would say everybody came together very quickly. In a matter of weeks, we had this model up and running. And that's still being used to this day. We've pivoted it to risk and vaccine, lack of vaccine hotspots, but that work is ongoing. And the feedback from our members has just been wonderful. That, thank you for reaching out to me. I'm so happy you called, especially again in these early days when there was such a lack of information and so much fear about COVID. So that engagement driven by analytics really, made a big impact on our members.
Perfect. So Mike, just to couple of follow-on questions, because this is like population health at its best, right? And normally when you go and think about these kind of projects and programs, we run like 300 of these analytics COEs across the board. When you see these are like months and years, right? And somehow you were able to go and get the time factor was weeks, right? So if you can help a little bit about, like from a technical perspective, how were you able to kind of get things done? You were talking about various data sources put together. You were talking about activating the call center. So help me take us a little bit deeper into how did you technically achieve it? Then how did you achieve the last mile? Because the second big challenge is, I have the insights, but now what actually happens to them? How do you actually make the point to the member and how do you hear it back? Make it a little bit more real on that, Mike.
Sure. So, as mentioned, we were well primed to do this. We have a lot of data on our members. We're always looking to customize outreach to members and understand specific member needs. So it really became a question of, well, what can we do now? There were so many unknowns at the time, so many unknowns about, everybody at the time wanted to predict, well, when can we go back to work? When will things be normal again? We quickly realized with the rest of the world, we weren't going to be able to identify that, but we could use our data that we had in hand, augmented with what we saw in the public health landscape. And this is changing by the week, if not the day at the time, but we were scraping data from the web. What are we learning about high risk stratification by the day? What are new conditions that are showing as high risk? What are populations that are showing high risk? What are hotspots? What are member clusters in populations density in these hotspots? And then we used our infrastructure we had internally, which is our care management outreach team, to quickly pipe them this information. And the key here was the priority, because the numbers are big at the time. You have a lot of members in hotspots, and who do you reach out to first? And that's where we use that the vulnerability index and high risk index to say, well, these are your top members. They're at most risk. Get in touch with them using that the infrastructure we already had, but engaging those folks in a new way. And that's really how we did it. We just looked at, well, what's the impact we can make today? What's the data we have today? And what are the tools we have today? And we just aligned those together and got that outreach initiative going in a matter of weeks.
Wonderful. And Himanshu, what investments had you done prior to that enabled you to do this? Like when you said you were well primed for it, Mike mentioned. So what were the investments you had invested in that helped? And the second question is decision making. Like, were you getting more support from the organization around the topic at that time when it happened?
Yeah. So I think in terms of investments, first at an organization level, we had been for a while investing in enabling remote working, right? Never knowing, not recognizing that at some point in time, 98% of our workforce would need to be virtual, right? But that is something that was an enabling investment that we had been making as an organization. And almost within a week of sheltering at home and working from home, like all the systems were up and running and working in the ways that we needed them to. Then in terms of enterprise data and analytics, we had made investments going into this journey, starting from way back in 2018, and with a good deal of help from Genpact and other partners in the space, is a cloud platform, which allows us both to scale the compute requirements that we had, but also be able to correlate and collate different data sets, as Mike mentioned, internal, bringing in new external operational data that we were creating. Also on top of it, we had built libraries of algorithms that were used for example, for segmentation, targeting, other related models that we were able to bring together. And then we had enabled our core team on these platforms and had been training different components of the team all along through the journey. Again, never recognizing that this would be so helpful or critical in the middle of a emergent situation like a pandemic, but just knowing that that's where the puck was moving and that's where we needed to get to. Alongside, from a broader enterprise technology perspective, our technology team has also made tons of investments, both, like I mentioned, in enabling remote working, but also simplifying data pipes and data flows within the organization. So when we talk about getting data from the front lines almost in terms of what we are seeing coming in through the claim systems, being able to pipe them through to the Enterprise Analytic Hub, which is what we essentially use for advanced analytics and data science. And also the other way around, being able to now take the insights that we're coming up with and pipe them through to our systems. So I think it was never in the context of being a emergent situation. It was always in the context of we are making incremental investments where we are best seeing the opportunities. And in this case, both of those happened to align.
Interesting. And by the way, I mean, knowing, being closer to the organization and some of the investment, I'll say one more thing, which was really interesting, is how you used a very agile delivery model in terms of working through the organization that I've seen is somewhat unique. I mean, it's well known, but not a lot of people are able to do it as well as you guys have been executed, which I think helped with the decision cycle times there.
Absolutely.
Yep, that's a good call out. We almost take it for granted now, but that's a good call out.
Yes. Esteban, I know, I mean, you obviously, like me, have looked at a whole host of other clients too in the ecosystem. Is that experience that Himanshu and Mike shared like unique, or what else? What did you guys see from your vantage point?
Well, I would say that it's not necessarily unique in the sense that all players in the healthcare system were facing the same challenges a year ago. And what COVID did is accelerate roadmaps from 5-year roadmaps to 5-week roadmaps, and in some instances, getting things done in 7 to 10 days. I think the fact that Blue Cross Blue Shield of Massachusetts had groundwork in place to be able to execute on that was important. And Himanshu spoke to the cloud platform and the ability to scale and to be able to move very quickly, either through data and analytics capabilities or cloud computing or the various other options that cloud brings. And so clearly I work for Google Cloud, and as a hyperscaler in the industry, we're working with lots of clients that are now looking to move off of prem or on premises databases into the cloud in order for them to be able to effectively scale the capabilities. When I was at Healthcare Service Corporation, and I had a variety of different roles there. I was the president for Southwest Texas. I was the chief medical officer for the state of Texas. And my last role was the chief medical officer for clinical strategy and innovation. One of the challenges that I was looking to solve for is how do we unlock the value of the data that we had? Because health plans, really, the value that they have is not their ability to adjudicate claims or create networks. It's really the data that they have, and unlocking the value of that data to be able to better manage members, provide real-time, reliable information to members, similarly actionable data and insights to physicians. And that's how you're going to, one, preserve the small margins that health plans have. You're going to need to use technology and artificial intelligence, machine learning capabilities, and advanced analytics to be able to achieve that, to really be able to not only create a better user experience for your members and your providers, but to be able to reduce the administrative costs that we all know in the health insurance industry are so incredibly high, from call centers or nurses and doctors doing very manual work, much of which can be automated through existing technologies.
All right. When you bring up an interesting point, Esteban, and Himanshu, I'll just moving on. So, like, coming to today, right? And I'll reference an interesting discussion I had with one of my friends and colleagues who is in a large health system, and I was just catching up, and he was asking how things are going. It's the same question, what like a year from now, and what's happening today, and her reaction was, listen, Amaresh, this is great. I mean, everyone realized the importance of data, and all my data projects are not kind of at the back of the line anymore. There are some investments I'm getting. Now things are a little bit stable. I don't really know whether they're in the front of the line right now. They will go back or not. So it was really an interesting point she was making. Is like, yeah, it was great because it was a crisis. Now it is there. It's a little bit stable. Obviously, we have a vaccination rates thankfully are going up, and in different places of the country. But coming as you stand today, Himanshu, how the situation has stabilized. What has been the reaction? Like, are your business partners and your executives asking you to kind of keep the same momentum? Are they asking you to do more? Are they funding you more? I mean, in this whole thing around the population health, or even broader, where does things stand today?
Yeah, and a good question, Amaresh. I think so. Number one, not unexpectedly, the demand for enterprise data and analytics services far outstrips the supply, right? And we as an organization and we as a function are in a constant prioritization mode to say, what should we focus on next? Again, in keeping with the principles of Agile, we are adapting, but at the same time, some outcomes take a certain amount of time, some sprints, waves of work to get through. So we're constantly balancing and managing that. I think in terms of, if I step back and take a look at the broader healthcare system, what's different now than what it was a year, 15 months ago? And Esteban, to your point, many of the investments, and not just financial investments, but also other resources in terms of senior leadership focus, right? Or the kinds of conversations that providers and plans and customers are having jointly together. The adoption of the new channel of services, or the relatively till date unexploited but now prominent channel of services like telehealth, right? So all of that is causing a more compressed and a faster rethinking of the core premise of healthcare, right? Which is who needs care? How are we identifying that? How are we being more proactive around that? And we, from an enterprise data and analytics perspective, see lots of questions and use cases around that space. Then who should be providing this care, right? So what's the best point of intersection between unmet need and which providers, and not just providers at a general categorization level, but down to the specific individual providers, and also the channels through which this combination should be made. When should care be provided? So there's a lot more questions now about the appropriate timing of care and being predictive and then prescriptive about that. What kind of care should be provided, right? Which is this whole thinking around, I mean, if I go back and look at one example, exactly this time last year, if you think back, there was a lot of concern. Some of the care had started to return, but there was a lot of concern and fully justified amongst members and patients of going to physical healthcare facilities to get the care that they needed because enclosed spaces, all of those concerns. So which of those services could be still delivered in person, but brought outside of a physical facility, right? So like, parking lot kind of care, like what can you actually extract from a physical building and bring it out? And, now all of this is becoming it's no longer an add-on to the core business focus areas. Like this is where the business focus areas are. And this is where most, if not all of the asks of data analytics are centering around.
So what do we...
If I might interject there, I think you're absolutely correct. And rethinking even population health as we normally think about it, managing large populations and controlling chronic conditions, or there's a lot of proxies out there. So there were, we knew that Google searches that were people were looking for GI symptoms in certain locations was predictive of COVID by about 2 weeks and COVID deaths by 4 weeks. So feeding that information to health plans, because obviously like a Blue Cross Blue Shield in Massachusetts, if suddenly people are doing GI searches in Grafton, but not South Boston, then you could potentially use that proxy information to start focusing on your membership in Grafton or other parts, if it's Framingham or other parts of Massachusetts. So really getting down as close as you can to an N of 1 to then use services intelligently to then focus on certain areas to not just react to the disease but to prevent the disease or prevent things like communicable diseases like COVID.
Right. No, exactly. Very, very valid point, Esteban. And that sort of moving forward where we go, that is one of the areas that we have to focus on is how do we bring in net new data into the ecosystem, non-traditional data that we wouldn't necessarily have thought about using or exploiting in the past. I mean, we did use things like Google mobility data as one of the overlays, right? And then you combine it with, for example, which professions or categories of professions are people employed in to create a risk index. But yeah, I think those are the kinds, and Amaresh, back to your question, I think there's a lot more appetite for those kinds of data sets and those kinds of investments and those kinds of focus areas now than there was perhaps 15 months ago.
But just trying to make it a little bit more contextual is the strategic part of it. I normally hear from business leaders, people are, they know it's the new normal is going to be different, right?
Yeah.
Do they connect? However, the second order question is, do they connect it to the investments in data, tech, cloud would lead to that? And is that still a priority right now? Or do you see things kind of regressing into, it's kind of one of those capabilities we'll need? Like what's like, and Mike, if you could answer that question and from a context of how does your day look like right now compared to a year ago? Because that's where the rubber hits the road.
Well, a lot more Zoom, a lot more. No, and I could say quickly too. That as you mentioned, analytics has been a key part of our corporate strategy for many years now. What I think was a big difference on the ground for my team was the adoption from the business. Leadership has been pointing us in this direction, but as Himanshu mentioned, there was maybe less of an appetite to adopt predictive models or text analytics or outside data sources outside of just our traditional claims and demographics. And we really saw that change rapidly this year. And I do believe that's here to stay. And we already see it in projects that are, unrelated to the pandemic or even population health, that the business areas that were not so comfortable with advanced analytics are suddenly demanding it, and I think that's here to stay.
And is it are folks more demanding, or your business partners more demanding? And if they are more demanding, what form does it take right now?
I mean, I think it's, we've seen a pivot where, when enterprise analytics was really launching and getting off the ground, we were kind of informing the business about, what analytics could do for them. And I think that's still the case. However, now we're getting the questions, the demand is coming from the business. It's, we need a predictive model. We can't just understand our, our net promoter score or our first call resolution. We want to know it today, but we want to know really where's it going? And we hear that now. We don't need to kind of educate as much on why they need this. They can kind of tell us what they're looking for in their specific business area, and we can help them get there. And there's less kind of communication on, well, can we trust a predictive model? Is that going to confuse our customers? Is that going to mislead us? We're really moving in that direction now, where this is a part of every decision.
Yeah, I mean, I've been told that COVID-19 has been like the biggest data literacy program that was launched.
That is true.
Yeah,
that is true.
exactly.
Yeah.
So it's a kind of.
Well, think about it this way, though. For instance, data and analytics is going to have to be at the core of almost every business unit at a health plan. You need data. I'm a firm believer that every business unit in the health plan needs a data analytics partner that's dedicated to that or part of the organization, very much like a hub and spoke model. But if we think about, for instance, health equity, if we start attacking health equity and health inequities, that's 80% of a person's health outcome, healthcare costs. And so zip code is much more important than genetic code when it comes to healthcare outcomes. Only 20% has to do with the healthcare that I provide as a physician, and 80% has to do so much more with where they live. So if we can start mining that data and analytics capabilities, and again, not boiling the ocean, but focusing on that low-hanging fruit of health inequities, that we can then start attacking, like Black maternal mortality, Black infant mortality, those type of things. I think our analytics partners, coupled with the business organization, especially healthcare management, are going to be key to be able to affect that change. And not only is it the right thing to do, obviously, from a member perspective or a patient perspective, but it's the right business decision as well.
And
that's the one. Completely agree with that. Yeah. No, Amaresh, I was just going to add to Esteban's point. I think number one, 2 points that you referenced. First is, the whole idea of partnering with the business, the hub and spoke model. That's exactly what we have in place now. And I think that's one of the foundational enablers for us to be as agile and therefore as successful as we have been. I think second is, so this year forward, equity is now a formal part of the mission. Healthcare equity is formal part of the mission of Blue Cross Blue Shield of Massachusetts. And we're still early in that journey. But one of the things that I'm beginning to glean through our focus there and what we're trying to do there is the idea of, the individual going to the healthcare versus healthcare coming to the individual. It's something that's been talked about a lot over the last decade, maybe even longer. But now we are actually starting to see the means, the pipes, the data, the insights, the actionability to make those things real, right? So there is the core of the inequity which has to be solved for within today's healthcare delivery system. But then a lot of the solutions, I don't know yet what proportion or percentage that will emerge over time, but the initial data is pointing towards require creation of a new kind of healthcare delivery system, one that is more digital, one that is more just in time, one that is more where the member or the individual is, as opposed to the gravitational pull of having them come to a physical brick and mortar facility and that being the primary center for which through which care is delivered. So yeah, absolutely agree on all those points.
Yeah, that it's going to be, it should be completely bird. Today we call it telehealth or virtual care. In 10 years, it's just going to be healthcare, right? No one's going to think
right. It's just care.
This on your phone or in a forward capability. We're in that embryonic stage of virtual care and providing artificial intelligence and machine learning and natural language processing, all of which will give people the access to care at the right place at the right time in the right channel. It may be never seeing a physician or a provider face to face on its screen. It may be filling out some information and taking a picture of a rash and having that go to a provider who makes the diagnosis. That might be powered through cognitive intelligence, such as artificial intelligence, but ultimately it's the provider who's making the diagnosis and rendering that
right.
care and meeting the member or the patient where they're at. And especially as we think about millennials and Gen Zs, they're going to be much more virtual and less loyal to either a plan or a provider. So we have to, again, change the way that we do business and be much more digital while still rendering care, with the highest quality possible.
Exactly. Yep.
Let me take a little bit skeptical view, but this one this was great. I mean, I wanted to ask you about what is like kind of Google's perspective on kind of where the healthcare is moving. And I think you guys got into it and you started answering that is what the vision for healthcare is. It's like, okay, location independent, a lot of based on data, different user experience. The reality is, if you are a little bit of a skeptic, I mean, we've been talking about this for some time, right?
Right.
And is COVID a big enough jolt? I'm not sure. So Himanshu, day to day, what are the barriers? It's not like anyone would disagree to that vision. Why can't we make it real and fast enough?
Yeah, I think the barriers are also in some ways the most important problems to be solved for, right? And to my mind, one of the biggest mounds that we have to come over is the whole idea of incentives, right? So, and not just financial incentives, but outcomes incentives that are in place across the providers, the individuals, our customers, other ancillary parts of the system which come together. And so far, my experience and read is we've tried to align incentives from within the healthcare ecosystem. And that has certainly yielded its fair share of results, a lot more to go there. I think with what we are talking about today and going forward, a lot of those incentives are going to be forced upon the healthcare ecosystem more broadly from an outside-in perspective, right? So we see, and it's in my opinion, a welcome change is new entrants moving into this ecosystem. Existing entrants, which we might have thought of as traditional players, like the big hospital system, starting to adapt and adopt the whole idea of digitization of healthcare more fully and more openly. Maybe till even a couple of years back, maybe even 15 months back, the whole idea of AI was sort of thought of as, okay, is AI going to come in and replace the doctors and the physicians? No. Doctors and physicians will be better enabled through this, but the AI plus doctor is likely to replace those without, right? So there is greater acceptance in the system about, okay, these are technologies and capabilities that we have to work with. And I think that's where the lining up of the incentives, whether it's done through a contracting process, whether it's done through a revenue share process, whether there are state level mandates and goals that we need to align against. there are different laboratories within the country, right? Each state is a laboratory of its own. Uh, but I think I'm very optimistic that the momentum that we have built and what we've shown ourselves as a healthcare system ecosystem, right? How quickly we can adapt. It will carry forward. And the investing profile is already starting to change. If you look at external investments coming into the space, they have started to reshape significantly. So there's all healthcare has always been a very active space just because the truth and the perception of how much headroom there is between where we are and where we can get to, but even more so now.
And I mean, I'll just do probably a round robin here. So Himanshu, if you were to kind of talk to your peers, I mean, there's a lot of a lot of your peers who are interested in data analytics and technology listening to this. What would the 2 or 3 pieces of advice would be that you would have for them?
Oh, good question. I think tenacity and perseverance with the discipline of data analytics is critical. I think it's when you're making foundational investments and there isn't as much of the tip of the iceberg that's exposed in terms of the outcomes, it can be a challenging space to be. But persevering through those is critical. Esteban brought up this very important point, being super aligned with where the business teams and the business units are looking to go to, right? So do some level of experimentation, validate it, and then build it, as opposed to trying to build the perfect thing and the spaceship to Mars, if you will. And then to Mike's point, the whole idea of working with new kinds of data and new categories of algorithms and new ways of exploiting the assets that we have in place. I think those are much more practical in today's world. And that, in my experience, leads to your point, Amaresh, before, more investments, more front of mind positioning for data and analytics, as opposed to what we have traditionally thought of this space in the past, which has been, okay, we have to start with a big check and then we can get things going. The reality is we can start with small checks and incrementally build on top of that.
Perfect. And Mike, I mean, as a practitioner, on a day-to-day practitioner, as things evolve and go forward with this grid vision Himanshu and Esteban laid out, what would your advice be to your peers who are dealing with this?
Well, probably no surprise coming from an agile analytics team that flexibility probably number one. And you may not know where you're heading, but having that scalability and that flexibility to adapt and evolve. And that's something that we think about in every project. Even designing the COVID risk analysis that evolved off of, as Himanshu mentioned, previous analytics assets, and that evolves into a vaccination outreach asset, and that evolves into potentially, as Esteban was alluding to, a health equity risk model. You're always thinking about where we're heading, and are we building in a way that we can quickly pivot and insert a new variable and apply the analytic asset to this new problem and new approach and keep evolving. So that flexibility is key. Always bring in new data, be willing to toss things out when they don't work and keep what does work, and just kind of moving along in that flexible, agile way.
Perfect. No, that's fantastic. And Esteban, I mean, obviously, you're working with a lot of Himanshu's peers. What would be your ask to them? I mean, obviously, with this, in the context of the vision that you just laid out, what are the 2 or 3 things they should be thinking about? And Himanshu brought up a very interesting point around this tip of the iceberg, foundational spend, justifying that and being perseverant about that. That's great. But what's the flip side of it? And your perspective on it?
Well, I'm definitely going to agree. I mean, about building that foundation. I think of it as a layer cake, right? Mm-hmm. And so digital has to be that foundation of that layer. And then you just build on top of that layer by layer. I think it can be very overwhelming for a lot of health plans and think, well, what am I going to do? I mean, basically, a lift and shift to the cloud is probably the first step around that. And then from there, let's focus on what are the low-hanging fruits? What are the quick wins? What are the sprints that we can do associated with improving, let's say it's, contact center artificial intelligence, right? So working on your digital front door for members, or maybe it's focusing on utilization management and prior authorization and starting to automate some of those very manual processes. Or maybe, it's going to be looking at our claims process. But I think of so many opportunities, having been at a health plan for 7 years. I think of the producer experience, right? How do our producers engage with us? And do they engage with us in a digital way? Does it make it easier for them to sell our product? So there's so many capabilities from digital. I would say don't get overwhelmed by, oh my gosh, we're going to change the entire organization. Let's take that first step. And that first step is getting digital one on the cloud.
Got it. And just one other point, Himanshu, just before I kind of wrap up. The journey to the cloud, obviously you've gone through it, right? What are the one or two things you wish you did it differently, or the two or three things that you would have for folks to kind of consider as they go into it? I mean, obviously there's a foundational element. You have to be persevere around it. There are some use cases that you have to do. There's a whole host of things that are there. What have been your learnings? I know it's a journey that continues for you guys, but it'll be good to know that.
Yeah, I'll pipe in with a couple, and Mike, please feel free to add. I think the biggest sort of the revelation for me after the fact has been that trying to scale from the get-go and designing the cloud infrastructure, the platform, how you engage with it upfront is probably not needed as much as we are led to believe, right? So you can start small, you can start incremental, and you can build from there. I think probably we spent more time upfront trying to figure out whether this is eventually going to be scalable than we needed to, because as things have evolved, we figured out some of the scaling we need to do. Some of the scaling can be done with the platforms and the partners that we are engaging with. I think treating the cloud step in, if you will, as on an experimental basis is one. I think second is it is very important to have, to Esteban's point, a good set of partners to work with who have experience doing this, right? And I've done this on a more regular basis in order to accelerate, and going back to Mike's point around bring agility into how we are doing things, right? So there is a lot of pride of ownership and authorship that comes with trying to do it yourselves, and that's great, and we need to build that over time. But in the interest of stepping in quickly, step small, step in with a partner, step in with someone who's already done this.
Perfect. So just trying to close this down. This has been a fantastic discussion. Just going from like 15 months ago, kind of all the things that you faced and how you kind of overcame that, and some of the financial investments you had put in there that allowed you to kind of really make population health very, very real in a matter of weeks, to Mike and Himanshu's point. That was just fantastic. Esteban, I think the whole broader point around how this is the core fabric on which speed, you're going to drive speed, and that is going to be one of the key elements. And the second is just the customer experience is going to be very, very different as we go along. So I think that was a great set of discussions around that and some of the future around it. And if cloud data analytics is going to be one of the foundation areas, Himanshu, just the way you wrapped up in terms of thinking about even here, you can start small, focus on agile, and drive value while you're building the foundation. Guys, this was fantastic. I had a lot of interesting discussion, a lot of dialogue, and you kind of brought it all together from different perspectives. So thank you so much, Mike, Esteban, and Himanshu, for this conversation. And I'm pretty sure a lot of the folks will find it very useful.